Hey everyone, and welcome to today's Explainer. Today, we're turning the lens on our own bodies to unmask a truly silent threat: ovarian cancer. Now, I know just hearing that word can instantly put us on edge, but I promise you, as we go through this Explainer together, you're going to see that knowledge absolutely is power here. By breaking down the latest clinical data and medical research, we're going to figure out exactly what ovarian cancer is, how it operates, and most importantly, the proactive steps you can take to protect yourself or the women you love. You're going to walk away from this equipped with some genuinely life-saving information. So here's the quick roadmap for our health journey today. First, we'll look at the silent health threat itself. Then, we'll cover the biological mechanics and risk factors. Third, recognizing the warning signs. And finally, taking proactive preventative steps. Okay, let's dive into this with Section 1, the silent health threat. We need to talk about this number right away. 2 times. According to the latest clinical data, the number of ovarian cancer patients has literally doubled over the last 20 years. Doubled. That is a rapid and, frankly, alarming rise. And it turns out, cases don't just go up evenly across the board. They spike dramatically once women reach their 40s. What really surprised me when putting this together was realizing this isn't just some rare anomaly from the past. It's a growing modern health issue. If you or someone you know is approaching or over the age of 40, paying attention right now is incredibly time-sensitive. Now, you might be wondering, if cases are doubling, why aren't we hearing about it constantly? Well, ovarian cancer is only the 9th most common cancer in women. So in terms of sheer volume, it doesn't always make headline news. But here is the absolutely crucial part. Roughly half of the patients diagnosed with it actually pass away. It's highly fatal, mostly because it's notoriously difficult to cure once it advances. So when you combine rising cases with a really high mortality rate, understanding this topic becomes absolutely vital for us. Let's move on to Section 2, biological mechanics and risk factors. To understand the risk, we need to know how our bodies work. So what exactly are the ovaries? Think of them as small organs, roughly the size and shape of a quail egg. You've got 2 of them, sitting on either side of the uterus, and their job is pretty incredible, right? They hold the eggs that are the literal source of human life, releasing one about every 4 weeks during ovulation. They also act as a major factory for estrogen, which is a crucial female hormone. But, as we all know, biology changes over time. Once a woman enters her 40s, this ovarian function naturally begins to slow down. Estrogen production drops, and eventually, by around age 50, menopause kicks in. Now, what's really interesting about this slide is how a perfectly natural bodily function connects directly to cancer risk. The core biological mechanic driving ovarian cancer risk is something we call the ovulation link. The data clearly shows that the more times a woman ovulates over her entire lifetime, the higher her risk of developing ovarian cancer. Think about it like this. When a woman gets pregnant and gives birth, ovulation hits the pause button. Therefore, women who have never experienced pregnancy have uninterrupted ovulation cycles. That leads to a higher lifetime count and, consequently, a higher risk. And even for women who have given birth, if their first child was born when they were 30 or older, that risk still remains elevated. This really brilliantly illustrates the divide between high and low risk categories. So let's just contrast them side by side so you can see where you might stand. On the high-risk side, we have age 40 and up, and, as we just discussed, no history of childbirth. But there are 2 other massive factors here. First, endometriosis, specifically when it forms those chocolate cysts in the ovaries. And second, genetics. About 20% of ovarian cancers are linked to genetics, most notably mutations in the BRCA gene, which is known as hereditary breast and ovarian cancer syndrome, or HBOC. If you have this genetic mutation, your risk of getting ovarian cancer is up to 60 times higher. No way around it, that's a huge jump. Now, looking at the low-risk side, having 2 or more childbirths lowers your risk. Taking oral contraceptives, the pill, for over 5 years actually halves your risk, simply because it suppresses ovulation. And here's a wild one. A Japanese study found that getting 7 or more hours of sleep at night actually halves your risk compared to getting less than 6 hours. The exact medical reason why is still a mystery, but it's a fascinating connection for sure. Let's transition into Section 3, recognizing the warning signs. The top 3 symptoms reported by patients are lower abdominal bloating at 54%, lower abdominal pain at 50%, and frequent urination at 33%. I mean, these aren't exactly flashing red sirens, are they? Because the ovaries sit directly inside the abdominal cavity, cancer can easily spread into the abdomen early on, and that causes fluid to build up. This fluid is the culprit behind the symptoms. Women often report their pants just inexplicably feeling tight, even if they haven't eaten a big meal or gained weight. The pain isn't usually sharp either. It's often just this heavy, dull feeling. And the frequent urination? That's literally just the fluid pressing against the bladder, leaving it no room to expand. These are just ordinary, everyday annoyances masking a massive threat. But the warning signs don't stop there, because that tiny, quail egg-sized ovary we talked about, it can grow to the size of a human fist. Because of that, about a quarter of patients actually feel a hard, palpable lump if they lie down and press on their lower abdomen. All that built-up fluid can also press against the stomach and intestines, which causes a rapid loss of appetite or makes you feel completely full after just a few bites. And finally, because the ovaries control our hormones, the cancer can severely disrupt that balance. That leads to abnormal bleeding outside of your regular cycle in about 19% of cases. I want to just pause here for a second and ask you, why do we miss the signs? If the cases are doubling and there are actual physical symptoms, why is this cancer still catching so many people totally off guard? Well, it largely comes down to a lack of awareness and some really common missteps in diagnosis. Surveys reveal that only 37% of people even know that family history is a risk factor for ovarian cancer. But honestly, the biggest trap is the nature of the symptoms themselves. When someone experiences persistent bloating, a sudden loss of appetite, or having to urgently run to the bathroom all day, what do they usually do? They assume it's just a routine gastrointestinal issue, so they visit an internal medicine doctor. And because internal medicine doctors aren't necessarily hunting for gynecological diseases right out of the gate, the symptoms might not improve, the root cause is totally missed, and the silent threat is just allowed to keep growing unchecked. Okay, let's relieve some of this tension and move to Section 4, taking proactive preventative steps. Unlike cervical cancer, there is no standard universal screening specifically for ovarian cancer right now. You literally have to actively seek it out. Yet, 60% of women skip gynecological exams entirely. Why is that? Well, the vast majority, 65%, say they feel fine and just have no anxiety about it, while 23% don't even feel it's necessary. But here's the wake-up call. Clinical data shows that of the women who do actually go in for a gynecological exam, 1 in 4 are found to have some sort of abnormality in their uterus or ovaries. 1 in 4. Skipping your exams just because you feel fine is a gamble you absolutely do not want to take. So, the crucial point is, you need a game plan. Here is a clear, actionable, and life-saving checklist for you. Step 1. Know your family history. Talk to your relatives. Find out if there's a history of breast or ovarian cancer in your family tree. Step 2. Once you hit age 40, actively request an abdominal ultrasound as an option during your regular health checkups. And Step 3. If you experience persistent bloating, a heavy feeling in your abdomen, or sudden changes in your bathroom habits, please do not just settle for internal medicine. Make an appointment with a gynecologist to rule out any ovarian issues. Now, for anyone who discovers they're in that extreme high-risk category we discussed earlier, those carrying the hereditary breast and ovarian cancer syndrome, or HBOC, there are advanced preventative options available. It's actually medically recommended that high-risk genetic carriers seriously consider the preventative surgical removal of their ovaries before they reach the age of 40. This definitively lowers the risk of death from ovarian cancer. This is the exact same proactive step actress Angelina Jolie took when she was 38. And importantly, depending on where you live and your prior medical history, this preventative surgery, along with related breast surgeries, can sometimes be covered by health insurance. I want to conclude this explainer with a thought to really hold on to. 40 years old is the turning point. Don't let a silent threat go unchecked. Ovarian cancer might not make as much noise as other diseases out there, but its impact is absolutely profound. By understanding your own biological risks, paying close attention to those mundane, everyday warning signs, and taking the initiative, you can take total control of your health. But it does leave us with a massive question. As medical science advances, how close are we to finally developing a simple, universal screening for this silent threat so no woman is ever caught off guard again? Thanks so much for joining me on today's explainer, guys. Please share this information with the women in your life who need to hear it.